So the question is, my gums are inflamed, how can I treat it? So the question goes back to you. How do you know your gums are inflamed? Some people come and see me, tell me, oh, I got some redness on my gums, doc, and it could be just like a very, very mild redness on the gum tissue. It may just go away just with brushing. But I do have some patients that they have some redness that has been going on for a long time, and then sometimes the redness even bleeds. So I tell them, hey, how long have you noticed, or I ask them, how long have you noticed your gums bleeding? And they say, well, I have not noticed any bleeding at all. Or they say, oh, just off and on. So what I do is just like I'm going to do it with Reese right now. Reese, can I borrow your hand?
Yeah, sure.
Yeah, okay. So, hey Reese, if I touch your hand is not bleeding right now, correct?
Correct.
So what if I touch your hand right here, and if it starts bleeding, is that normal for you?
No, it's not normal.
So is that acceptable that if it starts bleeding when I touch your hand?
No, that's not acceptable. I want to get that checked out immediately.
You're absolutely correct. So that's the same thing. So some patients, when they come to me, they say, well, it doesn't bleed, but it does bleed when I brush. Or when they tell me, doc, it doesn't bleed only when my hygienist checks them or touches them, or when you touch them, it bleeds. So just like I was demonstrating on Reese, and you don't want your skin to be either bleeding by itself or when you touch. So either one of those are indications that you may be, you may have some, or you definitely do have some gum disease. So answer your question, my gums are inflamed. So when you say the inflammation, if the inflammation is very, very mild, more than likely it may go away by attending your dentist on for professional cleanings, or if they're not, they are inflamed, like what we call it as a moderate to severe inflammation. It could be due to a variety of reasons, including gum disease or a periodontal disease, or it could be some bite issues, or it could be some broken teeth, or it could be because of your partial denture, or it could be a denture you're wearing. So for these variety of reasons, unless you go to a dentist, it is almost impossible for us to tell why your gums are inflamed and what is the best treatment to fix that. So if you happen to be in the Dallas-Fort Worth area, come see us and we'll be happy to help you. If not, go seek a care from a dentist or a gum specialist or a periodontist in your area, and they should be able to help you.